Dr. Lagarde is going to join us, and she and Dr. Okafor are going to tell us how they're working together to bring some of the mayor's vision that Senator Harp has, but also to realize the full potential of the Fairhaven Community Health Center as one of the most prominent health centers in the country, because they have in fact been granted one of three centers given a grant to do colon cancer screening. And the reason is because, of course, they have been serving their community so well. They have 94% vaccination rate among children, and they have school-based health clinics, and they have dental vans and Bright Bodies diabetes education. So you guys are the stars. So go ahead, tell us how you're working together to make it even better.
So I'll start, Dr. Okafor. I really want to say that as a healthcare provider, you know, I took care of patients, primary care in gastroenterology for many years, and now I take care of neighborhoods and families and communities. How excited I am to be in a city with a mayor who has so repeatedly expressed her support for the wellness of the citizens of New Haven. She came out to Fairhaven last week and celebrated with us, as you know, when we announced this grant for colon cancer screening. She's come out very strongly in favor of programs to help with diabetes and obesity, both adult and child. So I'm really excited, and I very much want to continue some early collaborations and expand them, because I think together we can really make the city rock.
and you're very exciting as you talk about this, because the mayor, through her leadership, has been very excited about all the great work we are doing in New Haven. The Fairhaven Community Health Center has been an exemplary health center. The mayor actually believes, as you do, that people are very important. People that live in the city, they are very important. She believes that for us to move the city to be healthy, safe, vibrant city where people are gainfully employed, they attain the best education, that they have to be healthy. And wellness to her is important, because if we create, and that is our goal, if we create the conditions that will make people healthy, then we can actually address top causes of premature death in the city. People are dying early, and there are also top 5 causal of death why people are dying. And there are 3 conditions that keep coming up anytime you look at, why are people in this city dying early, which is premature death, and why are what's killing our people using the death records. You see that you will find out that heart disease is on top of it, is one of the conditions. Another condition in both area, and if you ask the question either way, you will also find out that cancer is another issue, and then you have accident. And if you go down a little bit more, you will have assault, which is why she's very interested in making sure we have safe city. And so the most important thing that we've been trying to do through partnership with Fairhaven and other collaborators in the city is, how do we create prevention, conditions that prevent these issues. So we have a lot. If you look at heart disease, then one of the things we've done is, and diabetes, one of the things we've looked at is how do we make sure people have access to food, address the issue of food insecurity, which New Haven Farms, as you mentioned before, is working on. And it will be interesting for you to share some of how you are doing it, because we have been partnering through our health department and other collaborators in the city to do that work.
But before Sue answered, I think one of the things Sue had talked about earlier is the education, the nutrition piece, and the education around diabetes and exercise, because people who have diabetes are disproportionately affected by heart disease, because diabetes affects all the vessels.
Right.
So that is so exciting that you're doing that piece, because New Haven, the bigger city, can take some example from what your Bright Bodies program is doing. So what else are you guys, how are you guys going to get this out apart from this program to the people in the community to say exercise is so important, you need to move, you know, and especially if you're diabetic, you need to move. But if you have diabetes in your family, you need to take preventive steps. So how is that going on?
I was just at City Hall a few weeks ago and with Dr. Okafor, and the mayor convened an amazing cross-section of the city to try to look at this issues, a number of issues, but certainly one of the bigger issues, which was that of diabetes and obesity. We had representatives from literally, the cross-section. We had the university there, we had city officials there, we had private sector individuals there, and it was really exciting because I really felt that there was a collective will to try to tackle the problem. And it's certainly with diabetes, we feel and we believe very strongly that at Fairhaven we've developed a model after many years of hard work. This is not something new. We've been doing this for a long time that is very replicable across the city. And when I brought this up in this forum, there was tremendous interest. So it's this bringing together, because a lot of times we function in silos.
Yes.
And by bringing everyone together and share these ideas, I think good things are going to come from it. So diabetes is one area, cancer prevention is another. That's something that Fairhaven Community Health Center back in 6 or 7 years ago participated in something called the Healthcare Disparities. It was actually a national effort and looked at community health centers, so health centers that had a disproportionate amount of lower socioeconomic, more minorities, and showed how with really pretty cost-effective means you can bring life-saving cancer preventive techniques into these communities. So we have amongst some of the highest, we do, mammography rates in terms of making sure all women are getting effective mammography in a timely fashion.
And the vans, don't you have the vans still?
So the van is actually something run by the hospital, but it does periodically come and sit in our parking lot. So we avail ourselves of all of these opportunities. And
now, Dr. Okafor says that number 3 in New Haven in terms of the health indices, the problems, and number 3 is accidents, and number 4 are assaults. Are you two doing anything to collaborate on reducing those? And how accidents is number 3?
So there are, I can tell you exactly how it lays out. What I'm saying, if you ask the question, what are the top, let's say top 3,
yes,
or even if you say top 5 causes of premature death.
I see. Okay.
And then you will find these 3 conditions.
Yeah, well, what
you
you're
will
going to do to reduce
accident. Okay.
What are you going to do to reduce accidents?
So there are many causes. One will be the drug overdose. So there are many causes when we talk about accident. The other one will be the motor vehicle, but it's really not as high as the drug overdose.
I see.
So there is work we are doing, collaborating with people, including even homeless population, as well as persons that are well, and people that are older population. And we have begun to look at our data to identify where, because neighborhood matters, where do we have highest number of deaths occurring due to different types of accident. Our goal is to work with our elders, to work with people in the community, work with healthcare providers, work with the university, and work with even the media to bring awareness about this and to be able to educate people to actually address this issue.
Well, we're almost at the end of our program. In terms of assaults, we want to wrap up. In terms of assaults, I would imagine that maybe drug use is another reason for many assaults. Sue, is your center doing anything specifically to address assaults?
So we are doing something on a somewhat more global level in that we are very aggressively building our behavioral health department.
Yes.
So we recently...
And for that we're talking about mental health folks.
Mental
we
health,
used to
sorry.
call,
Yes. And we've just hired our psychiatrist. Because we are in a population that is primarily Hispanic, we we try very hard to hire only bilingual behavioral health therapists because obviously that's what our patients need. This is something that I'm very eager to discuss with Dr. Okafor and through her, the mayor, about our role in certainly in our community where we're so integrated in terms of, because mental health is huge. We do things called SBIRTs, which are these very rapid depression screening, and we find that even before people complain about that, we can determine that people have these problems, have anxiety, have depression, and these are things that we want to help patients deal with before they escalate into something bigger.
This comprehensive care you talk about allows you to identify those markers that send off signals. We are down to the last couple of minutes. So, Martha, can you tell us in a minute, what's your summary? What is the takeaway? What do you want people in the community who see this program to know and be certain about, and to help and collaborate with the mayor's office in addressing? You identify these things. What can we do to help to make them happen?
One thing we want people to know is that the mayor believes in collaboration and partnering with the city. The city will be very welcoming and open to partner with people to address this issue, looking at prevention because it works. The goal is to prevent the sufferings. As we talk about prevention, having the screening mammography, having the colon cancer screening because we can prevent the diseases, and also having healthy lifestyle, knowing how to cook healthy food, being active, and being engaged and connecting with each other. And through partnership, this will work, because an example will be the work we are doing with Yale University and like Dr. Lagarde talked about with the clinics, to work together and make sure we are building capacity in the community, in the neighborhoods, that people will know how to have a healthy lifestyle, how to access services, because if they do, we will be able to have an early detection of condition and then connect people to services that they will get in order for us to treat and control the diseases from making them not to be well. So our public health is very key, and they're working very effectively and in collaboration with other people as well as other aspects of the city government to get this done.
Okay, and I know that you're working with the Cornell Scott Hill Health Center as well, and the police department. There's a lot of collaboration going on, and that is certainly heartwarming. Again, we want to say to people that we are talking about total wellness, community outreach, building capacity within communities to help people to bring about the change they desire in their own lives. And the mayor is trying to reduce the disparities that occur in the city of New Haven, because as we heard earlier in our program, the cultural differences, if you will. We have 33% African American population in the city of New Haven of over 129,000 people, 31% Caucasian, and 27% Hispanics, almost a third, and yet we have tremendous disparities in education and health and in socioeconomic conditions. The mayor is trying to reduce these. The Fairhaven Health Center under Susan Lagarde's directorship is trying to address some of these issues with various programs, as we explained before. And under Dr. Martha Okafor's community services direction, Mayor Harp is trying to address them and to build a healthy, vibrant New Haven for everyone. We're glad you joined us for this 21st Century Conversation. Join us again for another 21st Century Conversation when we'll bring you some issues about what's happening with our young people. And we encourage you to visit us on Facebook, follow us on Twitter, and visit our YouTube channel and send us feedback. We like to hear from you. Give us suggestions and donate time and effort to helping us to make our programs even better. Thank you very much. Thank you so much for being here. It was a pleasure.
Thank you very much.
Pleasure. The first time meeting the both of you.
Thank you.
And good night, everyone. What's the matter? Were you laughing?
We pull it off.